Diabetes mellitus is a group of metabolic diseases in which there are high blood sugar levels over a prolonged period. Diabetes is due to either the pancreas not producing enough insulin or the cells of the body not responding properly to the insulin produced. WHO Diabetes Diagnosis Criteria. As per WHO Diabetes Diagnosis Criteria, it is set on the basis of glucose present in blood before and after meal. A fasting blood sugar level less than 110 mg per deciliter or 6.1 millimoles per liter is normal. A fasting blood sugar level greater than 126 mg per deciliter or 7 millimole per liter is considered pre-diabetics. In case of postprandial blood sugar level, less than 140 mg per deciliter or 7.8 millimole per liter is normal. Blood sugar level greater than 11.1 millimole per liter, or greater than 11.1 millimole per liter, or 200 mg per liter, is considered as diabetes. Type 1 diabetes mellitus. Type 1 diabetes is caused by an autoimmune reaction in which the body attacks itself by mistake, that destroys the cells in the pancreas, that makes insulin called beta cells. This process can go on for months or years before symptoms appear. Type 2 diabetes mellitus. Type 2 diabetes mellitus begins with insulin resistance, a condition in which cells fail to respond to insulin properly. It is also referred to as non-insulin dependent diabetes mellitus or adult onset diabetes. Gestational diabetes. Gestational diabetes occurs in pregnant women with or without a previous history of diabetes. The hormones produced by the placenta prevents the body from utilizing insulin effectively, resulting in an excess of glucose into the bloodstream, and the inability of cell to absorb glucose adequately, resulting in gestational diabetes. Signs and symptoms of diabetes. The classic symptoms of untreated diabetes are weight loss, polyuria, increased urination, polydipsia, increased thirst, polyphagia, increased hunger. Symptoms may develop rapidly within weeks or months in type 1 diabetes, while they usually develop much more slowly, and may be subtle or absent in type 2 diabetes. Complications. Diabetes can cause many complications. Serious long-term complications include heart disease, stroke, chronic kidney failure, foot ulcers and damage to the eyes. Complications. All forms of diabetes increases the risk of long-term complications. These typically develop after 10 to 20 years. The major long-term complications relate to the damage of blood vessels. Diabetes doubles the risk of cardiovascular disease. About 75% of deaths in diabetes are due to coronary artery disease. Some other reasons are due to macrovascular diseases or stroke, peripheral vascular diseases. The primary complications of diabetes is due to damage in small blood vessels, including damage to the eyes, kidneys and nerves. Damage to the eyes is known as diabetic retinopathy, caused by damage to the blood vessels in the retina of the eye, and can result in gradual vision loss. Damage to the kidneys is known as diabetic nephropathy, which can lead to tissue scarring, urine protein loss and eventually chronic kidney disease, sometimes requiring dialysis or kidney transplant. The word diabetes was first recorded in 1425, and in 1675, the Greek word mellitus, meaning like honey, was added to reflect the sweet smell and taste of the patient's urine. an unrelated and rare disorder. Similarly, in Ayurveda, a condition in which a person possesses honey-like, sweet urine is called madhyamika. Hypoglycemia, reduced insulin production and decreased insulin sensitivity are the contributing factors for hypoglycemia. It is one among 20 types of prameha, urological disorder, described in various Ayurvedic classics, that is Charaka Samhita, Sushruta Samhita, Ishtanga Sangraha, Madhavanadana, Yogaratnaka, etc. Ancient seers have narrated that excess use of ghee, heavy digest, snigdha, unctus, amla, sour, and lavana, salt, rasa, navana, food prepared from newly harvested grains, new wine, asyasukha, sedentary lifestyle, atinidra, excess sleep, avyama, lack of exercise, achinta, lack of mental exercise, obtaining from samshadhana, purification, therapy, are the causes of madhyamika. Dekha Herbal presents Glucare Capsule. Glucare Capsule is a proprietary Ayurvedic medicine made of various Ayurvedic herbal ingredients, used for overcoming type 2 diabetes and its complications, along with long-time non-healing wounds. Some of its major important ingredients are: Jamun regulates blood sugar levels by activating beta cells in the pancreas, which improves insulin action. Meshishringi stimulated insulin secretion from beta cells in the islets of Langerhans, which help to manage blood sugar levels. Vijaysa not only helps manage blood sugar levels by reducing pancreatic cell damage, but it also helps to lose weight, improve digestion, treat bleeding issues and treat a variety of skin inflammatory conditions. Shilajit helps to regulate blood glucose levels and improves lipid profiles. Belpatra modulates the release of insulin from cells into the bloodstream, and its low glycemic index helps to keep blood sugar levels stable. Glucare maintains blood glucose and safely controls sugar level. It also acts as a remedy for long-term non-healing wound. Glucare helps maintain healthy insulin level, minimizing long-term diabetic complication. In addition, it protects the blood cells from oxidative stress. Glucare package encapsulates 60 capsules in each box, which is taken 1 to 2 capsules twice or thrice a day, or as per directed by the physician. Oily, spicy and sour foods should be avoided. The container must be stored in an airtight container away from direct sunlight in a cool and dry place after use.